That's what I was just going to ask you about. What comparisons can you draw on with other states and Oregon?
So as I mentioned, the geographic access relative to other states in Oregon is quite high. Again, that 91% coverage figure for children in the Oregon Health Plan. However, when we look at dental care use rates, Oregon tends to be on the low side. So in the most recent data, 42% of children in the Oregon Health Plan had a dental visit in the past year. That's below the national average and is on the low side when we compare to other states. So when you put these results together, you find that children are not visiting the dentist as much in Oregon compared to other states, yet the geographic coverage of dental care providers is actually quite extensive. And that to me is the power of this research. It points to some very clear policy responses.
And what are those policies?
So my big takeaway from this analysis is that there needs to be somewhat less focus on pure supply interventions, increasing the number of providers, and much more focus on what I call connection interventions, which is making sure the population knows where dental care providers are that accept their coverage, has easier navigation services so they could find appointments at convenient times. And one other thing to note is reimbursement rates in Oregon through OHP are quite low compared to other states, and for dental care are quite low compared to for medical care services. So it could be that providers might be limiting their capacity because of those low reimbursement rates. We certainly have strong evidence from other states that that can be the case. So again, I would suggest more focus in Oregon on connecting providers with the population and perhaps re-examining payment models so that they're a bit more innovative.